When we started, when this first came up within the revenue cycle, when I was approached by my CFO and senior vice president to talk about it, at first I was like, oh, here we go. We're going to be outsourced.
Other vendors have come in, and the outsource providers do this. They come in and they dictate. They tell you, I've got one way. It works, and you signed up for it. What Capta came in has met us in the middle. It started with a conversation. What's working well for you? Here's our ideas. How do you prioritize it? And they let us as leadership lean in and weight those. So it's a hugely collaborative approach. And what's happened is it's built this culture of partnership and aligned incentives between management and a vendor.
Capta has came in and provided tools and services and a level of expertise that has allowed us to filter truly to what our personal need is, and that they basically they're part of our team. They're an external party, it's a partnership, but the level of collaboration and teamwork has been, again, as I've stated numerous times, beyond what I expected.
That was one of the conversations very early on we had with our staff. We've been very transparent about the relationship with Capta. And there was a concern, like if you have vendor partners or you bring efficiency, what's going to happen to us? We don't have enough people to do the work that we do today, right? We don't have enough to hit every box that we need to. What Capta has allowed us to do is improve automation, on the more mundane work, improve, our bot, our RPA technology. And what that's done is then we call it upscaling here at Presbyterian, but we've really been able to upscale our people and focus them on the more complex work, the work that requires, a lot more thinking.
What's really fascinating is you would think, okay, there's going to be an arrogance that comes in from the partner then with that. They're going to come in, they know it all, and they're going to say these 15 things you have to do. It's not how it works at all. It is very, very collaborative.
I immediately wanted the Capta team to meet the leadership team here at Presbyterian, give them opportunities to interact with them. That builds the relationships. Presbyterian is a very relationship type organization, and so it's very important to develop those relationships early on, and that really helped alleviate fear.
They came in and consulted with our leadership team collaboratively to drive the initiatives to prioritize, so it fits really well culturally.
I want to highlight the halo effect this is having, not just on the bottom line, but just generally contagious improvement that I'm seeing in open dialogue. I think engagement is probably as important as anything, particularly internally. So we're having leaders just curious now. When we mention Capta, they understand. And we can have very open dialogue conversations around what's possible. What are the opportunities? You're best in class, you're improving. How can I improve?
Capta offers a challenge to us to cross the functions to truly get to the better performance and the better delivery of care to the community. It's really a powerful equation.
So our volume continues to go up. And so we've been able to work out a strategy with Capta that first fills our void where we can't work the volume that we have, which has been incredibly helpful. It's also allowed us to focus our internal resources on the more complex denials, which has been helpful for that because it's not something you can automate.
And so what's actually happened is the work on development has shifted to Capta, and at a much higher execution rate, much better. And my team has now been able to lean in more to the front office side, the front facing with the patients, with the consumer, which is, as we talked about at the front end, also growing in importance.
The key, what we're seeing today, is that we're all in this together. We like to say that we're all in one family, it takes a village, but we're truly seeing that today in the conversations that are very open and very healthy, and folks are vulnerable, and they're willing to let down their guard and what's possible.
What I always say is, we've got more than enough work to do, and we have expanded organizationally. Like, we've added hospitals, we've added ASCs, we've added freestanding emergency rooms. We haven't added any staff to the revenue cycle in over a decade. Matter of fact, we're a fraction of the size that we used to be. So we have to continue to reinvent ourselves in order to succeed and help the organization succeed.
Capta came in as a disruptive offering. It would supplement our leadership team, improve our technology, and also supplement our capital abilities to afford. that enabled us to go in an entirely different way than where we originally thought we would go.
It's opened up those doors across the organization internally to continue to improve, which is what we need to do. Continuous improvement is what we strive for.
And I think what we've been able to demonstrate with Capta is that we've been able to improve an already very strong performing revenue cycle.
What I would encourage leaders as they're considering partnerships like Capta, particularly with Capta, is to understand that it has helped us from a level of arrogance that we had, that we were best in class, that it really, I'd recommend to step back and allow someone to partner with you and show you that there are ways to improve beyond what you expect, and just look at the problem under a different lens, from a different perspective. And again, I'm surprised the success that we have, and I know others could achieve such.